What are portosystemic shunt procedures for liver health? Imagine a busy highway where traffic gets stuck in a traffic jam. In the liver, a similar problem can happen when blood flow through the portal vein becomes blocked or slowed down. This condition is called portal hypertension, and it often occurs with severe liver diseases like cirrhosis. To help ease this problem, doctors sometimes create a new pathway for blood to flow more smoothly. These are called portosystemic shunt procedures. The most common method is the transjugular intrahepatic portosystemic shunt, or TIPS for short. This is a minimally invasive procedure done with imaging guidance. A doctor inserts a thin tube through a vein in the neck, guides it into the liver, and then creates a small channel between a branch of the portal vein and a hepatic vein. A tiny metal mesh tube called a stent is placed in this channel to keep it open. This new pathway allows blood to bypass the damaged liver tissue and flow directly back to the heart, reducing the high pressure in the portal vein. Reducing this pressure is very important because it helps prevent serious complications. For example, it lowers the risk of bleeding from enlarged veins in the esophagus or stomach, known as varices. It also helps control fluid buildup in the abdomen, called ascites, which can be very uncomfortable. Compared to traditional surgery, TIPS is less invasive, does not requiring open surgery, and usually has a lower risk of complications. However, like all medical procedures, portosystemic shunt procedures have risks. One common concern is hepatic encephalopathy, which happens when toxins build up in the brain because the liver is bypassed and cannot detoxify the blood properly. Not everyone is a good candidate for TIPS. Patients with very poor liver function or high bilirubin levels may have less favorable outcomes. That's why careful evaluation and ongoing monitoring are essential. In the context of liver cancer, these procedures are mainly used to manage symptoms of portal hypertension. They do not treat the cancer itself but can improve quality of life by controlling complications. The decision to perform a portosystemic shunt depends on individual health status, liver function, and cancer stage, and should always be made by a team of specialists. In summary, portosystemic shunt procedures like TIPS are valuable tools in managing severe liver problems. They help lower blood pressure in the portal vein, prevent life-threatening bleeding, and ease symptoms like fluid buildup. But they are complex procedures that require careful planning and follow-up by experienced healthcare providers. Always consult with a liver specialist to understand the best options for your specific health needs.